Thank you, Madam Chair, and I appreciate you holding this important hearing. For decades, drug overdose deaths have remained at an unacceptable level across the United States. Just last year, we lost over 4,400 Pennsylvanians due to drug overdose. That's 12 deaths per day on average, which is 12 too many. I hope this committee and the House of Representatives can get to work on solutions that save lives and enhance the 21st Century Cures Act and Comprehensive Addiction and Recovery Act. Thanks to these efforts and President Trump's leadership on the issue, more resources are available to fight the opioid epidemic. Naloxone is more widely available to prevent overdoses, which has led to encouraging downward trends. However, more work is needed to reduce deaths related to opioids. This includes holding companies like Purdue accountable for their deceptive tactics. Starting in 1996, Purdue Pharma and the Sackler family marketed OxyContin, a drug at the forefront of our nation's opioid epidemic, as having much lower addiction risk to patients, which sharply contrasts with the reality that this drug has cost lives and torn families apart. So just a couple questions I would have for Dr. Landau. What is your company doing to educate patients and providers about the danger of overprescribing opioids?
Thank you for the question. It's obviously a very important topic. The company has for some time been syndicating the guidelines produced by the Centers for Disease Control since they were issued in early 2016, which I fully support. We're also, as I mentioned in earlier testimony, supporting a tremendous amount of education, through third-party resources to bring to bear and bring to the surface important information relating to both the prescription of opioids, their safe storage, their disposal, the consequences of addiction, with an emphasis on children, on school children, to prevent them from their initial exposure, which can have devastating consequences, as we've heard in earlier testimony from family members who've lost loved ones.
Okay. Also, it's my understanding that as CEO, you have instituted reforms such as ending your company's use of tactics like detailing, where sales representatives target prescribers in an effort to boost sales. How would you recommend Congress work with the pharmaceutical industry to prevent opioid addiction?
That's another tremendously important question, and I appreciate it. You're correct. Soon after becoming CEO in 2017, I made a decision to stop the sales representative-based promotion of opioids. We also decided to eliminate whatever speakers programs remained for our products. What I would recommend, as part of the solution, as I understand the purpose of this hearing is intended to solicit ideas, is to make training for opioids mandatory, as I mentioned earlier. And I would also suggest that efforts be made to require all of the medicines within this class, controlled release and immediate release opioids, to have barriers introduced to make them less susceptible or less attractive as drugs of abuse. Addiction is a tougher issue. It's a complex medical condition with various contributing factors. I think education of physicians, access to healthcare are vital.
Okay, and one other thing, since you have a background as an anesthesiologist, can you speak to the effectiveness of non-opioid pain management, things like nerve blocks, radio waves, and physical therapy?
Yes, I had a little trouble hearing the question, but I believe the thrust of it is speaking to treatments other than opioids to manage pain. So as a physician and as a physician who's treated pain patients, I am a full supporter of what's referred to as a multidisciplinary approach to pain. Opioids and other pharmacologic options are one, or represent a series of options, But there are other options which, in my view, need to precede the decision to initiate therapy with opioids. And these are non-pharmacologic options: physical therapy, behavioral therapy, cognitive therapy, rehabilitation, biofeedback. There are a number of modalities that are available that can be quite effective in combination with or in place of the decision to write a prescription. And I believe there are certain barriers, to patients at present, preventing or reducing access to those important treatments. So I would encourage any action that can be taken to open access up for patients for those types of therapies.
Gentleman
Thank
from-
you, and Madam Chair, I yield back.
The gentleman from Maryland.